Over the next few minutes, I'd like to talk to you about the updated colorectal cancer screening program at Naval Medical Center San Diego. Everyone is at risk for colorectal cancer, particularly if you're over the age of 50 and have never been screened for this cancer. Colorectal cancer is the third most common cancer in America and unfortunately the third most common fatal cancer in America. Though preventable, many beneficiaries never take advantage of the great screening options that are available and, of course, free. Every year at Naval Medical Center San Diego, between 30 and 40 people develop colorectal cancer. With our updated referral process, we'll be able to do better. Optical colonoscopy is the best screening test for colorectal cancer, but scheduling for this test for yourself can be onerous. Recognizing this problem, we have set up a simple self-referral process at Naval Medical Center San Diego. Self-referral for optical colonoscopy will be accepted if the following conditions are met. First, you cannot have any of the symptoms listed here. If you do, then you should see your doctor for further evaluation. Second, you need to be of the appropriate age. For most people, screening starts at age 50. For African Americans, screening starts at age 45. For those who have at least one parent or sibling that has been diagnosed with colon cancer, then screening should start at age 40. If you satisfy these criteria, you can go to the website listed at the bottom of the page where you can fill out a short, simple questionnaire that will be screened for suitability for direct, open access for screening colonoscopy. Optical colonoscopy is considered the best test, or the gold standard test, for colorectal cancer screening. This is essentially a skin exam of the colon performed by a physician who uses a flexible tube with lights and a camera on the end called a colonoscope. After administration of sedating medications, the physician inserts the colonoscope through your anus and passes it through the entire length of the colon while looking for polyps. The reason that this test is so good is that it is very safe and very good identifying and removing polyps. Because everything is done through the scope during the procedure, surgery is not required. In most cases, no further intervention is necessary. Most people remember very little about the exam itself because they're sedated. Rather, it's the bowel preparation that has to be done in the hours before the procedure that most people dislike. The good news is that the newer bowel preparation formulations we use at Naval Medical Center San Diego are well tolerated. The downside of colonoscopy is that you and an accompanied adult must take time from your schedule to go to the endoscopy center for the procedure, which can be inconvenient. However, the greatest benefit is that because this test is so good, if your colon is normal and you have no significant family history of colorectal cancer, then no further screening test is required for 10 years. You should be aware that there are two other recommended screening options that are, though not as good as optical colonoscopy, are nonetheless effective and free for TRICARE beneficiaries. These are fecal immunochemistry testing, or FIT, and CT colonography, and will be discussed in greater detail later in this video. If you would like either of these tests instead of an optical colonoscopy, then you will need to talk to your doctor. Fecal immunochemistry testing, or FIT, is a stool test that looks for evidence of microscopic amounts of blood in your colon. This test can be performed at home and then brought back to the laboratory at Naval Medical Center San Diego for analysis. This test does not require that you undergo bowel preparation or a sedated procedure. If the test is positive, then you should undergo an optical colonoscopy to determine if the blood detected in the test was caused by colorectal cancer or precancerous polyps. When normal, FIT must be repeated on an annual basis to continue to offer any early detection benefits. CT colonography, or virtual colonoscopy, is a radiology examination that uses X-rays to detect possible polyps along the length of your colon. The exam is performed in the radiology department after completion of a bowel preparation, similar to what you would do for an optical colonoscopy. If the examination is normal, no other screening needs to be done for 5 years. If there's any concern for polyps, then optical colonoscopy is recommended to be done soon to find and remove any polyps. Additionally, because CT colonography images the entire abdomen, it's not uncommon that there are discoveries made that are incidental, that are unrelated to colorectal cancer screening and may require further evaluation or further testing. It takes years for colorectal cancer to develop. Thus, there is ample time for you to intervene and stop the process. Every year, gastroenterologists and general surgeons in the Combined Endoscopy Center at the Naval Medical Center San Diego are removing precancerous tissue from hundreds of patients undergoing screening colonoscopy examinations, consequently halting the progression of colorectal cancer in these patients. Remember, if you satisfy the criteria listed on this screen, you can refer yourself for optical colonoscopy by going to the website listed on this screen. Alternatively, you can stop by the gastroenterology department at Naval Medical Center San Diego, located in Building 2, 3rd deck, between the hours of 9 a.m. and 2 p.m., Monday through Friday, excluding federal holidays, to complete the questionnaire in person. If you are deemed to be a suitable candidate for optical colonoscopy, then you can schedule your procedure at that time and pick up your bowel preparation. Otherwise, we will get you started in the right direction so that you can get the appropriate screening test.